Hey, good morning, everyone. I'm Vic Senese. I'm the host of the show. Glad to have you joining us today. After this holiday break with Christmas being over and New Year's not quite yet being here. So we're glad that you could join us on UroNurse to spend some time with us. If this is your first time checking us out, be sure to check out our website at uronurse.com. Best place to go to learn more about the show. Check out all of our sponsors that help support this show and watch all the past episodes. And we've got 178 of them as of today for you to look at. Also, if you want to listen in your car, no problemo. Just go ahead and check out our audio podcast area with Apple Podcasts, Spotify, iHeart, Amazon, and YouTube Music. We are all over the place, so you can just listen to us for the audio version. Today's going to be a fun episode. I do this every year. I just kind of scour the whole gamut of what's coming up new and exciting. And before I get to that, let me bring in new and exciting because I also have Lori joining us today. Lori, welcome to the show.
Good morning. Happy holidays, everyone.
Yeah, it's been fun to kind of do this remote thing. So I get out of my usual habits of how things should fall in. But I see your house is dressed up for the holidays. Beautiful tree. We went out and had to have something for the holidays, and we were going to bring our tree in the car. Well, I couldn't, slipped a toothpick into the car after we finished packing, and our tree was pretty bulky. So we decided to order a tree, and I got this little 4-foot thing, as skinny as can be, but it still feels like Christmas. So as I said, today's episode, we're going to go through all the different things I could find out that is coming or pretty close to here that I think might be neat for us to look at for future episodes. So I thought I'd just run through that, and we'll go into that right now. Hey, this is one of my favorite shows to have. It's the Urology Breakthroughs for coming up year, next year, 2026. So I scoured the internet. I found some new products that I think are going to be pretty interesting and promising, and hopefully we'll see more about them throughout the year. But let's get started. I really like this one. The InnoCare's Egress Safety Catheter. It's a breakthrough in patient care as the first urinary safety catheter designed to automatically deflate if pulled out with the balloon inflated. Now, how many of us have had to take care of a bloody patient because they pulled their catheter with the balloon inflated out through the urethra? I've seen it. But this one's unique. The pulling force activates a secondary deflation mechanism, automatically deflating the balloon prior to forced removal. Now, this device is FDA cleared under some new classification for Foley catheters and accessories with additional safety features. The first ever device under this new code. So look for it. It's available. I actually saw some prototypes at the FAUNA meeting in Louisville, and it just kind of blew me away. So I definitely wanted to include it in this talk today. Here's another one. I keep talking about how AI is going to make life better. Well, here's something called DryQ. It's an innovative monitoring technology that transforms senior care with real-time solutions for families and healthcare providers. So how does this work? Well, DryQ's health monitoring technology is a smart, non-invasive system which can monitor how incontinence care is managed in senior living, home care, or maybe clinical settings. So what happens is at its core is a thin, battery-free sensor that adheres to the outside of any adult brief. No special diapers, no tubing, no suction. It uses radio frequency system to detect moisture instantly. So the minute that somebody starts to get wet, it's going to let you know. It's going to send a real-time alert to the caregiver's phone or their tablet or a nursing station or whatever so that they can respond promptly to remove that wet diapers, so you're not sitting around in wetness and risking skin breakdown, discomfort, infection, all those things. But beyond just wetness detection, its platform integrates additionally by monitoring functions such as mobility tracking, fall detection, getting out of the bed, so it could warn you somebody's climbed out of bed. You're taking care of an elderly parent. Heck, I'll probably be someday myself. And you get a little confused and you try to get out of bed and it'll warn you. Also, this I think is kind of cool. Geofencing. If you haven't heard that term before, it basically knows where you're at and kind of creates an artificial fence. So if somebody steps beyond that amount, it's kind of like those dog fences. It warns you that they've left. So it can be really a big plus in healthcare for the seniors. So, hey, this is another great device. I think it's going to be a big one to look for in 2026. Now, here's another one. I do urodynamics. I've done urodynamics my whole career, been involved in it. But one thing that always bothered me about urodynamics is it's an artificial test. You're taking a snapshot during the time you're doing the test of their bladder function. Now, it gives us great information. There's no doubt about that. But it's not a normal urination system. Well, I saw this one called Glean Urodynamics. It revolutionized bladder function testing with a wireless catheter-free technology. The way it works is you can see this little thing inside the bladder that's inserted, and patient goes home with it. They go home with that and a flow meter. It can measure pressure. So if the bladder is contracting when it shouldn't, you'll know that. How hard it's pushing to get the urine out, you'll find that out. And with a flow rate attached to it, you can measure the flow. You might even use one of those things that we're going to talk about later called Proud P, which can monitor flow rate without any kind of special equipment, just your cell phone. But anyway, let's take a movie or play this little clip I got on that. In urodynamics. Plus, the nice thing is you get to test the patient throughout the day, so you get more than just one reading. Hey, here's a new one. Barrigel TM, hyaluronic acid rectal spacer. This is getting to be a big thing with radiation to try to protect that rectum. So the Barrigel is an injectable hyaluronic acid rectal spacer designed to protect that rectum during prostate cancer radiation therapy by creating a temporary customizable, there's the key, barrier between the prostate and rectal wall. Unlike preformed spacers, Barrigel is moldable in real time, allowing clinicians to shape and adjust the separation for optimal anatomy-specific coverage. This added distance specifically reduces radiation dose to the rectum, lowering the risk of bowel toxicity, pain, and long-term complications. And because it's made from hyaluronic acid, a substance naturally found in the body, it's biocompatible, safe, and gradually absorbed over several months. Barrigel provides a targeted, patient-tailored solution that enhances both treatment and safety and overall quality of life for men undergoing prostate radiation therapy. So watch for that one. All right, here's something. The Clarius HD3 portable ultrasound, handheld ultrasound machine. Just FDA declared AI software built into the scanner that automatically measures prostate volume in seconds, helping clinicians assess conditions like BPH and prostate cancer more efficiently. With Clarius, there's a broader trend of AI-enhanced imaging and diagnostics in urology. So, hey, this is something I've always thought would be great to have, a little device that you could hook up to your phone, scan anytime you need to. I used to go around and make rounds at the bedsides in the hospital where you didn't always have your equipment like you have maybe in your office. This would be handy. Fits right in your pocket. UroRinse Lite is a medical device that automates bladder irrigation for patients with long-term urinary catheters, directly addressing the most common and challenging hospital-acquired infections linked to catheter use. Catheter-related urinary tract infections, or CAUTI, are increasingly difficult to treat due to contamination and antibiotic resistance. And current manual irrigation methods are inconsistent and limited to clinical environments. The UroRinse Lite replaces this with a fully automated button-activated system that delivers consistent, safe, and standardized irrigation cycles. It also manages complications such as blockages, blood clots, hematuria, making care more predictable and preventive. Designed for hospitals, care facilities, and homes, it is simple enough for caregivers or patients to operate without clinical training. Integrated mobile app and secure cloud connectivity allow remote monitoring and expert support, enabling clinicians to guide care beyond the clinic. So UroRinse Lite shifts bladder care from reactive treatment to proactive infection prevention. Looks interesting to me. I'd like to see more about it. Maybe we'll get someone to present on it this year in 2026, because I'm always interested in what's new and exciting. The Altis single incision sling is a minimally invasive, implantable mesh sling designed to treat female stress urinary incontinence caused by urethral hypermobility or weakness of the sphincter. Now, here's how it's different. Unlike traditional full-length slings that require multiple incisions and exit points through the abdomen or groin, Altis uses a single vaginal incision and anchors the sling internally, avoiding external skin exits, reducing tissue trauma and generally enabling a shorter, simpler procedure, often done under local anesthesia or even as an outpatient surgery. Pretty neat. The sling is made of lightweight, low elasticity knitted polypropylene mesh and features a dynamic two-way adjustable tensioning system that lets the surgeon fine-tune support for the urethra during implantation, ensuring stable urethral support without excessive compression. This is being put out by Coloplast out in the UK right now. Clinical studies have shown that many women experience significant reductions in pad weight, improved continence in the first 6 to 12 months, with acceptable safety and satisfaction rates up to several years post-implant. Keep your eyes open for that one. Gemtesa, not a new drug, but a new use of the drug that got approved. So the FDA approved Gemtesa, or Vibegron, for adult men with overactive bladder symptoms, urgency, frequency, leakage, gotta go, who are already taking medications for an enlarged prostate, good old BPH. So you got this combination therapy. So, we take a drug like tamsulosin, which helps to open up the prostate, make it easier to urinate. But still, patients may complain that they're getting up several times at night to go to the bathroom, or they're, still having this urge rushing to the bathroom. Well, that's because that big prostate's also causing some overactive bladder issues. Now you combine that with a beta-3 agonist, you can get symptomatic relief of the overactive side, along with better flow with the tamsulosin type drugs, the alpha blockers, and whoopee-doo, you've got a new treatment option for your patients if they're suffering from both. ProArc. Here's kind of an interesting thing I found. We've been always doing all sorts of crazy things to help prostates get opened up. And the whole big thing right now is what we call minimally invasive surgeries for the prostate. Well, here's a new one, the ProArc Medical, innovative minimally invasive treatment for BPH associated with lower urinary tract symptoms. The system uses a specialized delivery device to place an arc-shaped, you can kind of see that picture there, tissue-embedded implant into the prostate tissue via a circumferential diathermy incision. We're going to show you a little clip on that so you can see it better how it's done, because I think it makes more sense. But this can be done in about 3 minutes and under reduced anesthesia. Little local and maybe a little Pronax, nitrous oxide or something along that line, but a local block, and you can do this. So let's get to our movie.
And causing urinary symptoms. So we insert our device into the obstructed area through a cystoscope and under direct vision. The delivery system is based on a balloon that deploys a pre-shaped nitinol implant into the implantation site and expands the surrounding tissue, bringing it into a desired shape and size. In a very fast and simple procedure, the urologist performs a circular incision and place the implant inside simultaneously, just like that.
That's
At
pretty
the end
cool
of the
how it
process,
goes
the
around in a
delivery
circle.
system is withdrawn, leaving the implants to expand the obstructed area.
You can see that arc is left behind, and that arc helps to keep the prostate open. relieving symptom problems. Quick, easy, and effective. We'll see. All right. Bot Image has received U.S. Food and Drug Administration clearance for its AI-driven software called Prostate ID, which supports non-contrast biparametric MRI for screening, detection, and diagnosis of prostate cancer. It uses advanced AI algorithms to automatically detect, segment, and classify suspicious prostate lesions, generating risk scores like the PIRAD style assessment, and produce 3D lesion maps helping radiologists identify clinically significant areas with high accuracy. In validation studies, Prostate ID achieved a standalone AROC, a measure of diagnostic accuracy, of 93.6%, outperforming unaided human readers and reducing false positives. Those of you who have been listening to me preaching about AI taking over certain jobs, radiology, it's beating a lot of the radiologists in some of this stuff. Because it relies on non-contrast MRI and integrates directly with standard radiology workflows, it can offer a faster, more cost-effective, less invasive alternative than traditional prostate cancer screening, potentially reducing unnecessary biopsies while improving early detection. Win-win, all good. So how does Prostate ID work? It works by analyzing urine collected after a digital rectal exam to detect prostate-specific genetic biomarkers associated with prostate cancer. During the exam, prostate cells are released into the urine, which is then tested for advanced molecular analysis to identify patterns linked to cancer risk. The results help clinicians determine the likelihood of clinically significant prostate cancer, supporting more informed decisions about whether a biopsy is necessary. Remember, trying to avoid those unnecessary biopsies. By adding personalized, non-invasive risk assessment, Prostate ID aims to reduce unnecessary biopsies while improving early detections of aggressive disease. So many things. All right, Vesica Health's Assure MDX. It's a clinically validated, non-invasive, urine-based genomic test designed to improve the early detection and diagnosis of bladder cancer, especially among patients presenting with hematuria. By analyzing a panel of 6 genomic biomarkers, these are going to be huge, folks. Just watch the future, including DNA methylation and of the genes TWIST1, OTX1, and 1CUT2, and somatic mutations in FGFR3, TERT, and HRAS. Assure MDX stratifies patients according to their risk of harboring bladder cancer. In multiple prospective clinical validation studies involving hundreds of hematuria patients, the test has demonstrated high diagnostic performance with an area under the curve of approximately 0.96, about a 96% sensitivity, and a negative predictive value exceeding 99%. So always we talk about how sensitive it is and then how predictive it is. So that means a negative result offers strong reassurance of low risk for finding cancer. This allows physicians to identify the high-risk individuals for prompt urologic evaluation while potentially sparing low-risk patients from unnecessary invasive procedures, such as cystoscopies or imaging, radiation from being exposed for imaging. Another thing that's going to be coming around. Fertility. Here's something that we are starting to see more and more stuff coming out about. So this is something called PS Fertility. It's a U.S.-based medical diagnostic company founded in 2019 in Charlottesville, Virginia. It aims to revolutionize male fertility evaluation by going beyond the traditional semen analysis. Now, remember, a semen analysis tells you approximately how many sperm you have and whether they're moving or not, so live or dead, and how normal they look. But their flagship product, PS Detect, is a mail-order test that measures the percentage of sperm expressing the biomarker, here we go again, folks, biomarkers, of phosphatidylserine. That's the PS in fertility. A critical molecular signal correlated with a sperm's ability to fertilize an egg. That's key. Sure, they're swimming, but can they fertilize? This will answer that question. So according to PS Fertility, a significant number of men with quote-unquote normal conventional semen analysis still have low PS scores, which may underlie unexplained infertility. PS Detect, therefore, provides additional, clinically relevant information that may guide treatment decisions such as varicocele repair or other fertility-enhancing interventions. By offering accessible at-home collection kit and more precise assessment of sperm fertilization competence, PS Fertility hopes to reduce the burden and uncertainty many couples face in their path to conception. This one's kind of crazy. Verve, the renal pelvic denervation for treatment of hypertension. You can kind of see that video thing that's playing there in the background, how it's simply placed in with a little catheter. It's a US-based early-stage medical device company developing a novel, minimally invasive treatment for hypertension, high blood pressure that does not require chronic medication. So no medicine. Their key technology, the renal pelvic denervation system, works by accessing the renal nerves through the natural urinary tract. So you go up cystoscopically with this through the ureter with ureteroscopically, and you put this little fiber in there, and you burn these renal nerves. By delivering controlled energy to ablate overactive nerve fibers in the renal pelvis, which contribute persistently to elevated blood pressure, you can lower somebody's blood pressure. In a feasibility study, this procedure achieved a mean 24-hour systolic blood pressure reduction of about 20 millimeters of mercury in patients with uncontrolled hypertension, despite the use of multiple antihypertensive drugs. No serious adverse events were reported, and renal function remained stable. Wouldn't it be great? You could get somebody off of their meds. They could just have this quick procedure and be drug-free. The future is bright. And Proud P. Proud P is a smartphone-based uroflowmetry and urinary health monitoring app by Soundable Health. We had this presentation by Alex Hughes about a month ago. This one just kind of blows me away, the information that you get. This is something your regular old cell phone can measure your flow rate by the sound the urine makes hitting the toilet. I wouldn't be a believer if I didn't try it myself, and by golly, it works. It even can figure out how much you voided from that. So you get a lot of great information. So it can look at the voiding patterns, and this information can be transformative for patients who are trying to be evaluated for issues with BPH. Class 2 medical device, recognized for its clinical grade reliability. It has an international prostate symptom score built right into it, a bladder diary, and I've talked about how I think bladder diaries are the most easiest test that we miss all the time. It should be done on anybody with urinary issues. So making this a really simple thing for people to do. It's called Proud P. And here's the big reason I'm introducing this one is the company. I was able to touch base with them, and they offered to give our viewers a 10% off code. So you can buy this by the month or subscribe. You subscribe for the system by the month, or you subscribe by the year. So if you want to get it by the month, it's UROMO10. If you want it by the year, it's UROYR10. And you'll get 10% off from using that code. Hey, it's good to save money, and that's one of the things that I think it's nice with UroNurse, that we're able to kind of collaborate with other companies to try to help you guys save money. So you can scan that QR code, or you can just go to our website. There's a link in our website that'll get you over to their website, and then enter those codes when you go and you load it up on your phone, and it asks you. You get one free test by the company, so you can try it out and see how you think it's going to work. But I think it's something that is really going to be an interesting, nice bit of information. So, hey, and always UroNurse News. Check it out to stay up to date on the latest urology research, emerging technologies, and patient-centered innovations shaping today's healthcare and into the future. So every day, Monday through Friday at 9 a.m., I break down the complex studies and clinical advances to keep you from having to do the hard work. Bring you this nice little 5-minute video presentation about what's going on. And I'm mostly, kind of look at urology because, of course, that's my specialty and that's what I've been doing the most of. But I don't limit it to urology. I've talked about why flossing is important. The flu season did something that was fear of finding out, so different things. I'm all over the place, so be sure to check that one out. So as we wrap up the holiday special of UroNurse, I've highlighted some of the most exciting urology breakthroughs shaping care in 2026, from advances in non-invasive diagnostics to precision medicine to smarter devices and expanded home-based care for patients. These innovations are not just about new technology, they're about improving outcomes, enhancing quality of life, and empowering nurses to lead the change at the bedside and beyond. So thanks for spending this part of your holiday season with me, and be sure to stay connected with UroNurse as we continue to bring you timely education, expert insights, and the latest developments that matter most in urologic nursing. Ho, ho, ho. Yeah, so there we have it. That's a little glimpse at some of the crazy new things I've found that's coming in the future. Some stuff that's already here. What'd you think, Lori? Oops, you're muted.
Sorry about that.
That's
Some of
all
those,
right.
I think I want to see what's going on with all of them. Every single thing that you presented was amazing. It's going to be very interesting to see.
I think that Pro Arc one, I mean, something they can put in 3 minutes, open a prostate, because minimally invasive procedures are every man's favorite,
Yeah, I'm really curious to see what it's made of.
It's nitinol. So that's that metal that can change and maintain shape based on temperature.
Interesting.
So
and I'm sure one of the first questions we'll get is, can I go through an MRI?
Yeah, I think so, but I'm not 100% sure. But it was interesting that it can be done so fast, because there's a few of these other things that they're doing where they're putting the nitinol compression springs in, but they have to be removed at another date, where this is just one and done. So that's kind of a neat thing.
Wow.
And then
Very good.
Yeah, I think all these bio markers and things that are coming out assisted with AI, it's just crazy how quick things are changing.
Yeah. And I also, one of the things I thought with the apps that you can get on your phone and the bladder scanner and all that is how quick the doctor is going to lose it and bring it to the hospital when you're in an office and lose it.
Yep. Yeah. It's one of the things that's happened. UroNurse has been around now for a little over 3 years. And I think it's gotten enough people know about us that I get a lot of companies that are out there reaching out to me saying, hey, we'd like to, feature our thing on your show, which, if it's a good quality product, I'm all for it. I'm not just going to put anything out there. But this new thing that I think is helpful for all of us is this willingness to do some collaboration, so that they're like Proud P was able to provide a 10% discount to people who listen to my show. So to me, that's a win-win. So I'll give them a little plug if they'll give my fans some money off. I've got a few other companies that I'm looking at right now looking at doing that similar model. So we'll see. Who knows what's going to happen in the future. But
I think I'm a little jealous that I haven't thought of some of this first.
Yeah, I tell you, it's crazy just to see, how things are coming along. So I've got my family peeking in the window at me. Yes, I'm still broadcasting. It's fun doing things on vacation.
His grandkids are in the pool.
Yeah. So they want me to go swimming. I guess I'll get out there sooner than later. But no, it's been absolutely wonderful being here. But I kind of miss my studio at home with a more comfortable chair. And this room, I don't know if you noticed it, but I can hear a lot of echo of my own voice.
Oh, no, I don't hear that.
Everything in Florida, I don't know what these architects are thinking of, but it's all these 10, 12-foot ceilings everywhere. They're all huge. So you get all this echo. And none of them have carpeting. They're all solid floors, probably because of the sand and everything else. But it's not a good combination for broadcast.
Sure.
Or at least for audio. All right. So thanks to all the fans out there that kind of gave those comments that you enjoyed seeing this, because I think I have as much fun doing it as you probably had watching it. So it's always nice. I'm going to leave you with a few things before the end of the year here. Any last thoughts you have, Lori, before we kind of wrap things up?
No, I'm excited for 2026 and learning all these new little gadgets, so it'll be fun.
Yeah.
So hopefully everybody can continue to join because it sounds like there's a lot of new stuff that we need to learn. So
absolutely. Yep. So now next week's going to be a little different. I'm going to be getting ready to travel back home. So I do have one that's going to be a CE. And I thought it'd be a great one for next week. So here it is, a promo on that.
Emerging therapies in prostate cancer. Key insights for urology nurses. A one-contact hour presentation with experts Leonard Gomella, MD, and Grace Cullen, DNP. In this episode, we explore the latest breakthroughs in prostate cancer care, from cutting-edge systemic therapies to evolving precision-based treatment strategies that every urology nurse needs to know. Our expert guests bring deep clinical insight into the rapidly changing landscape of prostate cancer management. This session is designed to empower urology nurses, advanced practice providers, and oncology professionals with evidence-based knowledge you can bring directly into patient care. Join us on January 3rd at 9 a.m. Central Time to learn more.
All right, so that'll be next week. It's good for one contact hour. It's kind of nice when you're working to get your contact hours to renew your license or your certification. These are mostly urology based, so they work for your certification. So enjoy that, courtesy of UroNurse. And it's my CME, which is, again, talk about collaboration. Here's another company that was willing to collaborate with me to allow me to use their presentations for these free contact hours. So it's all good.
great.
Now, here's a special holiday treat for everybody. Hope you'll find it special. So I think most of you know I kind of embrace AI pretty strongly for this program. Always looking at things to do. So I've got a new hobby. The grandkids love it. My wife, I drive her crazy with it. But I took a couple of AI things and put them together. And one thing is I've been, a past history of being a musician. So I started to go into doing some songwriting. So I did some songwriting. And actually for our trip up to Florida, or down to Florida, because we live up, down to Florida, I actually put together a whole Christmas album. Now, I'm not going to play the whole album for you, but I did have a couple of songs, or one song in particular I want to share. And then the other thing the grandkids are really enjoying is I decided to get into animation, and I've done some animation for them, of them. But anyway, I've got an animation with using AI, with a song that I wrote using AI, and I'm going to play it for you right now on our way out of the show. Lori's always great to have you on the show. I really hate when I don't have you here to do it with, because it's just a lot more fun to have somebody else to bounce things off of. But enjoy. I call it Kathy, the Urology Reindeer.
Kathy, the urology reindeer, had a bladder bright as snow. And every time she laughed too hard, a little squirt would overflow.
All of the other reindeer thought her job was quite unique.
She worked with Dr. Santa Claus at the North Pole Clinic.
Then one frosty morning, Santa let out a cry.
Kathy, Christmas Eve is coming. We need you to keep us dry.
Rudolph's nose is glowing, but we've got a bigger fear.
We need a reindeer brave enough to help with incontinence care.
Oh, Kathy, the urology reindeer, keeping Christmas dry and bright.
Teaching out pelvic floor exercises
every day and night. Kathy, the urology reindeer, leading with her caring heart.
Thanks to her, the Christmas crew can finish what they start. She passed out bladder diaries, taught hydration tips with charm,
warned the elves that coffee drinking could cause a bathroom alarm.
Even Mrs. Santa said she'd never felt so good.
Kathy, since your bladder classes, I'm now dry like I should.
So if you hear the sleigh bells on a peaceful winter night,
remember Kathy's guiding work to keep the holidays just right.
She's the hero of the bladder, the queen of continence care,
spreading joyful, jolly health across the world.
its magic moisture.
Free and flying dry. Kathy the urology reindeer, we raise our cups of cheer.
To healthy habits, happy hearts,
And no leaks through the
Well, there you have it, Kathy the urology reindeer. Have a great, happy new year, and we'll see everybody next year on UroNurse. Have a great one.
Bye, everyone.
So here's to the mornings, the coffee, the monitor glow. To the wisdom he shares and the folks that he knows. Saturday is special when Vic's on the stream with 40 years of knowledge and a head full of dreams.